What actually becomes dangerous after age 75? It's not always what people expect. For many older adults, the biggest health threats are not sudden accidents or rare diseases. They're common conditions that slowly build over time, often quietly, with subtle warning signs that are easy to ignore. The good news is this: many of the biggest risks in later life can often be reduced through simple daily habits, earlier medical care, and smarter lifestyle choices. In this video, we'll explore the most common causes of death after 75 and practical ways seniors can help protect their health, independence, and quality of life. Some of these may surprise you. Growing older does not automatically mean becoming unhealthy. Many people live strong, active, and fulfilling lives well into their 80s and 90s. But understanding the health risks that become more common with age can help seniors and families make better decisions before problems become serious. Here are 7 of the most common health threats after 75, and what may help lower the risk. 1. Heart disease. Heart disease remains one of the leading causes of death among older adults in the United States, and after age 75, the risk increases significantly because the heart and blood vessels naturally change with age. One of the biggest dangers is that heart disease does not always look dramatic in seniors. Some older adults never experience severe chest pain. Instead, they may notice unusual fatigue, dizziness, shortness of breath while walking, swelling in the legs, or discomfort in the jaw, neck, or back. Reducing the risk often starts with small daily choices. Regular walking, balanced meals with less processed food, maintaining a healthy weight, managing blood pressure, and staying physically active can all support heart health. Regular medical checkups also matter, because many heart problems can be treated more effectively when discovered early. Sleep is another overlooked factor. Poor sleep quality and untreated sleep apnea may increase strain on the heart over time. Staying socially connected and reducing long-term stress may also help support cardiovascular health in later years. Heart disease is common, but many older adults successfully manage their risk and continue living active lives for many years. 2. Cancer. Cancer becomes more common with age because the body's cells have had more time to accumulate damage over the years. After 75, cancers such as lung cancer, colorectal cancer, breast cancer, prostate cancer, and pancreatic cancer become especially important health concerns. One challenge is that symptoms can sometimes appear slowly or resemble normal aging. Unexplained weight loss, unusual fatigue, changes in appetite, persistent coughing, new pain, or changes in bowel habits should never be ignored. Smoking remains one of the largest preventable cancer risks, even later in life. But it's not the only factor. Long-term sun exposure, heavy alcohol use, obesity, inactivity, poor diet, and environmental exposures may also contribute. Many seniors believe it is too late to improve their health habits, but research continues to show that healthier lifestyle choices may still provide benefits at older ages. Quitting smoking, improving nutrition, staying physically active, and attending recommended screenings can all play an important role. Nutrition becomes especially important after 75. Diets rich in vegetables, fruits, fiber, lean proteins, and healthy fats may support overall health and immune function. Staying active may also help maintain strength during medical treatment if cancer is diagnosed. Another important factor is early detection. Some cancers can be treated more successfully when found earlier, which is why regular discussions with healthcare providers remain important even in older adulthood. Cancer is a serious disease, but many seniors continue to live meaningful, fulfilling lives during and after treatment. 3. Stroke. Stroke risk rises sharply after age 75, especially among people with high blood pressure, diabetes, heart disease, or smoking history. A stroke happens when blood flow to part of the brain is interrupted. In seniors, symptoms may include sudden confusion, weakness on one side of the body, trouble speaking, dizziness, or severe headache. Quick medical attention is critical because early treatment may reduce long-term damage. Managing blood pressure, staying active, eating healthier foods, and following medical advice may help lower stroke risk over time. 4. Chronic lower respiratory disease. Conditions such as COPD and chronic bronchitis can become more dangerous in later life, especially for former smokers. Many older adults notice increasing shortness of breath, coughing, wheezing, or reduced stamina during simple activities. Avoiding smoking, improving indoor air quality, staying physically active, and receiving recommended vaccines may help protect lung health and reduce complications from respiratory infections. 5. Alzheimer's disease and dementia. Memory loss is one of the health concerns many seniors fear most. Alzheimer's disease and other forms of dementia become more common after age 75 and can gradually affect memory, judgment, communication, and daily independence. Early symptoms may include repeating questions, forgetting appointments, confusion with familiar tasks, or difficulty following conversations. Families sometimes mistake these signs for normal aging, which may delay proper evaluation. While no guaranteed prevention exists, some lifestyle habits may support long-term brain health. Regular exercise, social activity, quality sleep, mental stimulation, and managing conditions like diabetes and high blood pressure may all help reduce cognitive decline risk. Staying socially connected is especially important because loneliness and isolation may worsen both mental and physical health in older adults. 6. Diabetes complications. Diabetes can quietly damage the body for years if blood sugar remains poorly controlled. After 75, complications may affect the heart, kidneys, eyes, nerves, and circulation. Some seniors also face increased risks of falls, infections, and slower healing. One challenge is that symptoms may not always feel obvious. Fatigue, blurry vision, numbness in the feet, or frequent urination are sometimes ignored until complications become serious. Managing diabetes usually involves consistent habits rather than extreme changes. Balanced meals, regular movement, medication management, hydration, and routine monitoring may help reduce long-term complications. 7. Infections and pneumonia. As people age, the immune system naturally becomes weaker, making infections more dangerous than they were earlier in life. Pneumonia remains one of the leading reasons older adults are hospitalized. Even common infections like the flu or urinary tract infections can sometimes become severe quickly in seniors. One reason infections are dangerous after 75 is that symptoms may appear differently. Older adults may not always develop a high fever. Instead, they might experience sudden weakness, confusion, loss of appetite, or unusual fatigue. Prevention becomes extremely important. Good hand hygiene, staying hydrated, eating nutritious foods, maintaining physical activity, and receiving recommended vaccinations may help reduce risk. Oral health also matters more than many people realize. Poor dental hygiene may increase bacteria in the mouth that can eventually affect the lungs and contribute to pneumonia risk. Families should also pay close attention after hospital stays, because infections sometimes develop during recovery periods when the body is weaker. Getting older is a part of life, but staying informed can help you stay healthier and more independent for longer. Small daily habits, regular checkups, and paying attention to warning signs may make a bigger difference than many people realize. If you enjoyed this video, don't forget to like, subscribe, and share it with someone who may find it helpful.